Welcome to our third practice video. This one is going to focus on working with our breath to build pressure and use our voice to help baby come down, turn and get out. And our breath and our voice can really help us in that process. I know a lot of times midwives, if you're not a second-time mom, you might have heard midwives say, hold your breath and push into your bum for me. And a lot of women just don't know what it means to push into your bum. It's really awkward and weird, and it can be quite hard. So this practice video will make it clear to you how you can use your breath in a good way to help baby come down without damaging your pelvic floor, your perineum, and you should have the best outcomes if you're pushing using that technique. In general, this is a practice video, so in a setting of labor and birth, you probably will not be in that position. You might be on your hands and knees, you might be, close to the floor, either in a deep squat or on your side or in a different position. But this is a really good position to practice it because gravity can help you work with the pressure and the breath to really feel how you're bearing down gently and helping baby out. So with that, let's start. We're going to sit, you can sit on a bolster like that. That's a pretty comfortable position to practice it. Or alternatively, you can sit cross-legged as well, or lying on your back. That's also perfect. We're going to work first on our breathing. So we're going to breathe in through the mouth. Like we practiced in our first video, we're going to breathe in as if it's like a little whistle, sucking the air in and hold. And just hold there for a couple minutes and then release and relax. We're just going to start with that. And I want you to notice where the pressure is building up to naturally as you're doing this. So let's breathe in and hold. And when you're ready, just relax. Moran, where did you feel the pressure going to naturally? Up, chest, and sometimes even head. Now imagine when you're giving birth, you might even use your voice, and if we use higher tones like it's even going further up. Imagine that, you can practice that with me. You feel it going up. And we're going to practice with our voice as our second stage, but practice it already now just to notice the difference. If you do lower tones, lower down, you will feel it really helping you down. So we'll start without the voice. We'll start just with building pressure. And I want you to breathe in, hold the breath, and then try and ask your body to build the pressure downwards instead of up and see what happens in your core. Let's try it out. So breathe in and hold. And now bring the pressure you build downwards rather than up. And really thinking with your intention and your muscles, directing the pressure down to your pelvis, to your legs, the pelvic floor, lower parts of the pelvis, and see what happens and then relax. The way we build pressure upwards, we can also direct the pressure downwards, and we can even direct pressure to the side. Sometimes it's helpful to practice with your hands to your side. Breathe in, hold, and with your mind and your muscle, imagine directing all the pressure to your hands, to your fingertips, and see what happens and how you feel, building that pressure to the sides, from the chest all the way to the side, and release. Did you feel it?
Yeah.
So now we're going to do it again and just focus on working with our muscle and our intention downwards to really bear down, and imagine we release and expand and direct our attention downwards. Let's breathe in and hold and direct the pressure down. And release. Now we're going to add the voice to it in our practice. So we'll start just with our breath, hold and pressure. And then I want you to work with a tone you choose, but again, Practice first with an upper tone. See what happens. See what happens in your body. As I do this, I already feel my pelvic floor contracting. So do it once with an upper note, and then we're going to move into animal sounds, and that's how animals give birth. We are also mammals, and it will really help you if you let go of the perception that you need to be quiet, even if you're planning to birth in a hospital setting. Midwives and everybody around used to this noise, and you need to feel really free to use your voice to help yourself and your baby in the birthing process. And the more you practice it, the more it will be easier to use that tool in birth. So are we ready? We're going to start with an upper tone. So breathe in and hold. Now start with an upper tone. Notice what's happening in your core. What did you feel?
Yeah.
It's going up.
Yeah, going up.
Okay, and now let's focus on lower tones. Again, we first use our intention, breath hold, and then use, and again, notice what's happening in your jaw. You really want to notice that your jaw is relaxed, because relaxed jaw means relaxed pelvic floor. It's a really good tip to remember. So again, let's breathe in and hold. Use your muscles and intention to direct downwards in the breath hold, and then let's use our voice to help this process. Let's do 2 more of this. So again, we want to feel how our noise helping us in that process. Breathe in and hold. Use the muscle, use the hold, use the pressure, and let's add the sound. It's a bit like the sound healing instruments, really low vibrations. Last one. Focus on releasing the pelvic floor, bearing down and using your voice. How did you feel? Did you feel it going down? Perfect. That's even better than pushing. So we'll talk about it in the next video, but for pushing, the more you let your body do it rather than intentionally pushing, the better it is. Waiting for the urge to push, especially if you're not on epidural and you're doing it, your body will just push when it's ready to push. You can help your body and your baby go down to the birth canal and really turn and complete its turn, and while using these techniques. So give it a good practice, and I'll see you on the next video.